Patients with intellectual and developmental disabilities, or IDD, often have a co-occurring mental health disorder. This is referred to as a dual diagnosis. Common types of dual diagnosis include mood disorders, anxiety disorders, including OCD, ADHD, PTSD, psychotic disorders, and substance use disorders. Depression is characterized by persistent feelings of sadness, hopelessness, and a loss of interest in pleasurable activities. DMDD, or disruptive mood dysregulation disorder, is characterized by severe and recurrent temper outbursts that are out of proportion to the situation. This can be hard to differentiate from ASD since the symptoms are present in both conditions. Bipolar disorder involves severe mood swings between depressive and manic episodes. Anxiety disorder is characterized by excessive worrying about future events. This interferes with daily functioning and causes the individual great distress. OCD, or obsessive-compulsive disorder, involves persistent, unwanted thoughts and repetitive behaviors or mental acts that an individual feels compelled to perform. There is a high prevalence of OCD symptoms in patients with autism spectrum disorder. Distinguishing between these behaviors as either part of ASD or OCD can be challenging since compulsions and rituals often overlap. ADHD, or attention deficit hyperactivity disorder, leads to impulsive behavior and easy distractibility, making it hard for the patient to follow instructions and control their actions. PTSD, or post-traumatic stress disorder, causes hyperarousal and intense overreactions to stress or unfamiliar situations. It is important to be aware of all these co-occurring mental health disorders when dealing with patients with IDD. Whenever they are present, it can be more challenging to treat the patient. Each disorder can exacerbate the symptoms of the other. Diagnosis and treatment can be even more difficult in the presence of communication and cognitive limitations. All of this means that a multidisciplinary approach is most likely to help our patients. Collaborative efforts between psychiatrists, mental health clinicians, and IDD specialists are crucial for comprehensive care. This involves tailoring interventions and support strategies to achieve desired functional outcomes.
When a person with IDD goes into a mental health crisis, they often have nowhere to turn other than the emergency department. This brings its own set of unique challenges for the healthcare team. It is essential to approach these situations with sensitivity, considering there may be communication barriers. The behavioral disruptions that can co-occur with a mental health crisis can be very challenging for the healthcare team and may require the use of chemical or physical restraints due to the severity of the behaviors. Caregivers and family members are often involved and can be a helpful resource to support the situation with their knowledge of the patient and their baseline behavior. It is important to remember that sometimes aggressive or violent behavior is not directed at anyone in particular and is not intended to be malicious. This behavior is typically a response to communication difficulties, frustration, sensory overload, or the inability to regulate emotions. It is important to understand the underlying causes and triggers of aggression in order to effectively manage and address it. The initial treatment for an IDD patient in a mental health crisis is often medications that help to stabilize the mood and behavior. It is important to ensure these patients in these scenarios have proper outpatient follow-up in place for support once the crisis has stabilized. A multidisciplinary approach is the most effective way to help support IDD patients with a dual diagnosis. Consistency with routine, Follow-ups along with wraparound services are the key components to help prevent future crisis-level episodes.